Here.
With a quorum, we will proceed. We're going to continue testimony on House Bill 1901. We're also going to open House Bill 1239 and House Bill 1969. Representative Kelly is still here. Representative, you weren't here yesterday, but Chris Mollendorf, I'm referring to him as Representative Kelly because while he's supposed to be quiet, he's floating around this room, chirping in people's ears. So.
He was highly insulted, is that? Good morning, Mr. Chairman, members of the committee. I am grateful for the opportunity to present for your consideration House Bill 1239. 1239 is straight out expansion to 138%. It's got no fixes, it's got no reforms, it's nothing but the expansion piece. Let me say before I start that I am grateful for and applaud the work that you and Representative Torpke and other members of the committee have done on the reform stuff. I believe that one of the, both politically and in terms of good public policy, the Republican ideas on some of the reforms that are necessary in our medical system are absolutely fundamentally important to getting the costs of medical care in this state and this country under control. And you two in this committee have been real leaders, and Representative Mollendorf, in this effort, and I'm grateful to have been a co-worker with you on this. To the degree that there ever was a reasonable argument against expansion to 138%, that understanding has been completely destroyed by the fiscal note, produced by our own fiscal note people, nonpartisan evaluators of the cost of legislation. Prior to the fiscal note, opposition was a thin reed to hang on because of the 4 independent private sector studies which all reached about the same conclusion, which is that Medicaid expansion to 138% is wildly productive economically for the state of Missouri and productive medically. And to fail to do it is to cost the state of Missouri literally billions of dollars. In my community of Columbia, Missouri alone, failure to expand Medicaid, according to our 2 hospitals, will cost Columbia $30 million this year. And you can, of course, write that large in St. Louis, Kansas City, and statewide. That is the reason that the State Chamber of Commerce and the Columbia Chamber of Commerce and the St. Louis and Kansas City Chambers of Commerce are all active supporters of expansion. Now, opponents will say, well, yeah, but you know who lives in those places. I submit for your consideration the fact that in such socialist hotbeds as West Plains and Potosi, the Chambers of Commerce are also fully on board. 50 Chambers of Commerce in the state of Missouri, and they are hard-nosed business people. They're making decisions about what is good for the economy of Missouri. When the big tornado hit the town of Greenfield, Kansas, what was it, 3-4 years ago? The people there, the town was destroyed, including the hospital. And the people had a meeting about whether to rebuild. The question that the people of Greenfield, Kansas, which is not unlike in many ways Potosi or Kabul or West Plains, what did they say? They said to the hospital people, if you rebuild, we will rebuild. And the reason they said that was because in so many of these rural communities, hospitals are not only the lifeblood in medical terms of the community, but they are economically the anchor for these towns. And if we lose these rural hospitals, we lose not only the capacity to deliver medical care in rural Missouri, but we also lose more of our rural communities and rural heritage. And they're the ones, Boone Hospital in Columbia, University Hospital, Barnes, St. Mary's. These institutions, the big ones in Jackson, are not going to close behind this. Your two big ones are not going to close if we fail. They're going to hurt, but they're not going to close. But let's look at all those rural hospitals in those communities where both the hospital and the community are much more economically challenged. Those are the communities that we will literally destroy by failing to expand Medicaid in the state of Missouri. We destroy the ability of people in rural Missouri to get health care, and we destroy those economic links to prosperity. The fiscal note is clear. $49 million more first year in the budget of the state of Missouri. That's not in the economy of Missouri. That's only in the state budget. And those numbers only go up from there. $150 million in 16, $155 million in 17. And on from there. And you can look at the fiscal note for the details. I'm not going to get down into the weeds on this. But in terms of the whole economy, and those numbers don't count, by the way, taxes. Those are only from the money we save by delivering medical care more efficiently. Let me give you only one example of that. There are many throughout the government, but let me give you the one I know the best because I used to be chairman of appropriations for corrections. Today, a prisoner who's treated, who has any medical care, is 100% a state burden medically. If we were to expand, he would continue to be 100% burden while he was in the institution. But if he went out of the institution for any other kind of care, like for instance, if he went from Algoa to St. Mary's, his care while in St. Mary's, if we were to expand, would be 100% federal. That's a huge savings. There are similar savings throughout the medically frail community, throughout the mental health community, throughout the alcohol and drug abuse parts of our service system. We have a whole range of state services whereby we will save very big money if we expand. We also have the tax revenue, because you know what? It's a good thing when people go to work in Potosi or West Plains. And if we expand, people will go to work in those communities, doing important things for real people, all of whom are working. Let me say that again. We're not expanding to the undeserving poor. To get to 138% of poverty, there's only one way to get there, and that's to work. And who you are, archetypically, is the single waitress with 2 kids whose employer cannot afford a health care plan. What happens to her? Her kid gets an earache at 5:15 on Friday afternoon, because that's when all kids get earaches. Where does the kid then go? You know this from your own experience with your little kids and being called home by your wife, if I remember correctly. What happens is she goes to the emergency room and she gets the most inappropriate and expensive kind of care imaginable. If we do expansions, the kid will have a medical home. The kid will be able to get the antibiotics, the medicine, the mother will be able to keep working. Everybody in society, from the kid to the guy who gets his ham and eggs in the cafeteria, will be better off. Mr. Chairman, I'm grateful for the opportunity, and let me say this. I hope a lot of people support my legislation, but I want them, if they want to testify, and I hope they just say we're for it rather than get into a big rigmarole, and I hope they do get into the big rigmarole when it comes time for Representative Torpey's bill, which I think is, or your bill, which are much more leaders in the field than mine. There's a political ramification to all this, and I want to remind my friends from the Chamber of Commerce, I refer them to, in the Bible, Hosea 8:7. Read the section and see this is what you get, where we are today in the state of Missouri, when you support people who make political or governmental decisions based only on irrational politics. So, with that, I'll be happy to yield to any questions.
Questions of the sponsor, Representative McManus.
Just to inquire briefly.
Proceed.
Thanks, Rep. Kelly. I just wanted to, I don't want to get in the weeds on the fiscal note, but I just want to make clear, so the 50 million positive for this year, that doesn't include the multiplier effect.
No,
the new
no
jobs.
multiplier. I didn't. The fiscal note people did not include it. In fact, they say in here they didn't include
Right.
multipliers.
Right. So that's literally just the cost savings.
Hard bucks.
And so not expanding, we don't get the 50 million for this year. So that's a negative.
That's right.
And then we also don't get whatever multipliers.
And we don't get the 1.2 billion federal. Was my number right about 1.2 billion on the federal? I think
Right, but we also don't get whatever multiplier effect happens from the new jobs and from the new economic activity, which could be greater than that.
It will be. We all know that it will be. In fact, we all talk about it every time we get up there with an economic development bill and talk about this is a jobs bill. Here's the ironic thing. If any of us were to isolate the amount of money that would come to our community, let's just at random pick a community. Well, let's say Poplar Bluff. And if the amount of economic benefit that is absolutely guaranteed to accrue from this legislation were to accrue to Poplar Bluff, Missouri, based on legislation that representative were to sponsor, he or she or I would be crowing from the rooftops. You must do this. It is so good for my local economy. Not to mention, of course, the people that would be treated. That's just randomly Poplar Bluff, I mean. Okay.
Representative, I've asked for I asked for Medicaid to be put through the Dr. Seuss bowling machine to get a score on it, and the Dr. Seuss machine is unavailable for it. It was available for bowling, but it's not available. Further questions?
Any questions? I'll be glad to entertain.
Seeing none, here's how we're going to do this. I'm going to go down and I'm going to talk about House Bill 1969, and then Representative Torpey is going to get up and reopen House Bill 1901, and then we're going to have witnesses who can testify to any provision either in 1901, 1239, or 1969.
Okay.
So, Representative Richardson, go ahead.
Yeah, I just want to say,
to close. You're right.
I want to say that I am fully supportive of and of the reforms that you and Representative Torpey have in your legislation, and hope we do that. But I wanted to make sure that we get straight expansion on the table in a way that was unequivocal. So thank you, Mr. Chairman and members of the committee.
Members of the committee, House Bill 1969. There was an email late last night. We made a last-minute change. Concepts haven't changed. I want to walk through this. At the outset, I want to talk about things that are not going to be added as an amendment to any, attempted to be added as an amendment to any bill this year. So we can kind of take them off the table for discussions as we go on. The first are changes to breast and cervical cancer, page 10, paragraph 2, sub 1. Second are changes to pregnant women and infants. That's page 10 and 11, I believe. Paragraph 2, subparagraphs 2 and 3. The third are changing the eligibility determination for age blind, process for age blind and disabled. Especially in regards to the eligibility determination process for ABD, although I'm not going to attempt to make an amendment this year. That issue is going to be on the table in future years. It's a little bit too big of an issue, I think, to handle without a long study, and session. So what we're left with are 3 items. First are changes to blind pension, second are changes to S-CHIP, and the third are changes to the Women's Health Program. All 3 of these reductions are contemplated in relation to increases in eligibility that are found in House Bill 1901. The changes to blind pension are on page 11 of the substitute. What this would do is we have no cap on blind pension health care benefits in the state of Missouri today. It is all GR money. We take that, we put a cap on it of 133% of the federal poverty level. For people on blind pension above 133% of the federal poverty level, we provide wraparound services, personal care assistance services that are not available in qualified health plans that they can obtain coverage for under the exchange. So they get the same benefits essentially that they get under the existing Medicaid program, but like others in their income brackets, they're expected to pay for a portion of their health insurance. That's part 1. Part 2 is S-CHIP. That is on page 16. Right now in Missouri, we have one of the most liberal S-CHIP programs in the entire country, more liberal in many ways than the ACA. This changes our S-CHIP program. By changing the definition of eligibility, or I'm sorry, of affordability to be consistent with the definition of affordability in the ACA exchanges. So if you look on page 18 of the sub, that definition, affordability is defined for individuals with income up to 133% of federal poverty level is 2% of their income, final premium, and then we have a sliding scale all the way up to 300%. This is an increase from the current amounts. Increases, again, we put it on par with the definitions of affordable in the ACA. And then the final change was on pages 19 and 20. This eliminates the Women's Health Program, which if we increase eligibility under House Bill 1901 is no longer necessary because these services are covered. These populations are covered and these services are covered for them within Medicaid. So there's no need for the state program any longer. If there are any questions, I'd be happy to answer them.
Questions for the sponsor?
Tell me about this S-CHIP change again.
Okay, so it's on page, do you have the copy of the sub?
I do have the sub, and you're talking page 16.
Page 16. So you're not, under current law, child is not eligible for S-CHIP if their parents have access to affordable health insurance. Have the statute in front of me with this. So 208640 has the existing, which starts on page 17, has the existing standards, and then page 17 or page 18, the new definition of affordable employer-sponsored health care matches exactly what the subsidies are on an exchange.
If I'm reading this, and I'm sorry, I haven't seen it before just this minute. What you were saying on, is it page 19 or 20, that basically there's 2% cost sharing?
Page 18, there's a 2% cost share for 100 to 133. For 133 to 150, it's 3%. Final premium percentage is 4%.
Okay, so it's on a sliding scale. I get that. And this is to cover the children or to cover the whole family?
Well, the children would be covered in an exchange plan. I've heard anecdotal testimony and private conversation with somebody from the department and read news stories about parents who are trying to sign their families up for exchange plans, and the exchange plan tells them that because their children are eligible under a state's S-CHIP program, that they can get coverage for themselves under that exchange plan, but the exchange plan will not cover the children. So then the parents go to the state's S-CHIP program and sign them up for Medicaid. Instead, when these parents sign up for the exchange plan, they ought to be able to cover their kids under the same plan. Because they're eligible, however, right now under Missouri law for Medicaid, they're put in a situation where they're forced to buy two different plans, pay more money, and they have a kid on Medicaid rather than in a private health insurance plan.
Okay, thank you.
Further questions, sponsor? Seeing none.
Thank you.
Thank you, Mr. Chair. House Bill 1901, just talking about eligibility changes. I'd like to start out first by saying, I think sometimes we forget what other states are doing, and it's important to look at those. But you know, Governor Rick Perry of Texas asked for a waiver to increase eligibility to 185% of the federal poverty level. Presidential nominee, and I believe is going to run for president again on the Republican ticket. You have Michigan, who's passed Medicaid reforms with expansion. Nevada, New Jersey, New Mexico, North Dakota. Pennsylvania is about to. Ohio is going to. All Republican governors. And I leave, last but not least, Iowa, with a Republican governor as well, and I say that because a lot of the language from 1901 has been adopted from there, and the eligibility requirements are the same as Iowa. Going up to 100%, the federal poverty level, and then going to the exchange, 101 to 138. I appreciate the kind words from Representative Kelly, and I think it's important to look at the policy. I mean, by independent organizations, that this House bill has been called the most conservative Medicaid reform expansion bill in the country. There's a reason for that, because there are so many reforms in there. And I truly believe the eligibility changes and reforms are linked together if we truly want to get something passed this year or down the road. With that, Mr. Chair, I'd be happy to take any questions.
Questions of the sponsor? Seeing none, Mr. Consent.
Thank you, Mr. Chairman, members of the committee. Brendan Cosette with the Missouri Chamber of Commerce and Industry, and here to testify in favor of House Bill 1901. And this has been kind of a difficult issue for our members over the years. We don't support federal mandates in the healthcare system, nor did we support passage of the Affordable Care Act or Obamacare in 2009 and 2010. However, it's law, and we're faced with two options. We can either hope and wish that it just goes away, or we can try to craft a more pragmatic approach to dealing with the issue and hopefully craft a Missouri solution to what is basically a Washington, D.C. problem. We think that House Bill 1901 is that solution to the problems caused by Obamacare. There are a number of specific reasons why we are in support of this legislation. First and foremost is the fact that with passage of this bill, $2.2 billion a year will come to Missouri and will be injected into the federal economy. And regardless of what you think about Keynesian economics, and I'm not a huge fan myself, I would suspect that not a ton of you are either, but that's $2.2 billion that we have streaming through Missouri's economy that wouldn't be here, that won't be here if we don't pass 1901. Secondly, dish payments are going away for hospitals, but yet sick people aren't. And a lot of sick folks are still going to be presenting themselves in emergency departments around the state, and hospitals are going to have to recoup those costs one way or another. It's likely to be on the back of employers who provide insurance to their employees or the privately insured. A third reason is, just beyond the economic or beyond the social and humanitarian benefit of having 300,000 more people with health insurance. These people, as Representative Kelly alluded to earlier, are working, and a healthy employee is a more productive employee and one who doesn't lose a lot of time to 6 days. We also share Representative Kelly's concern about the effect on the rural economy if hospitals in rural areas are forced to lay off their employees or reduce services or even go away. As he mentioned, and we completely agree, hospitals are the biggest employer or close to the biggest employer in a lot of rural areas. We've seen job losses and layoffs from hospitals throughout the state. BJC, SSM, Mercy, Ozark Medical in West Plains, Nevada Regional, Liberty Hospital, all had layoffs, over 1,000 this past year, and there's likely more to come. And this is not good for rural economies who really depend on having the hospitals there as an economic engine. And along those lines, 4 of the states bordering Missouri are expanding Medicaid: Iowa, Illinois, Kentucky, and Arkansas. And geographically, obviously, that covers approximately 3/4 of our borders. The states that are expanding Medicaid are going to have a much stronger healthcare infrastructure. Their systems are going to have a lot more money, and they're going to be in a position where they can poach our primary care providers, both docs and nurse practitioners and nurses, away from our hospitals, especially rural areas. And as we all know, there's a shortage of primary care providers as already. We certainly don't need lessening of that profession. And finally, Jackson Hewitt has estimated that the potential liability from penalties from the Affordable Care Act to employers in Missouri is between $35 and $50 million a year. And a lot of businesses in this state operate on pretty thin margins. And when you're looking at facing a $2,000 to $3,000 penalty for each employee you have, if we don't do Medicaid expansion, that might just be the tipping point to make you shut your doors. And so we think there's an incredibly compelling business and economic case for Medicaid transformation, reform, and increase in Mo Health Net eligibility, which is why we support House Bill 1901. Thank you for your time, and I'll be happy to answer any questions.
Questions of the witness? Seeing none, thank you for your testimony here today. Constituent of mine, Mr. Hill, Pastor Hill, I should say.
Thank you, Mr. Chairman. My name is Jim Hill. I'm the Executive Director of ChurchNet, which is a statewide network of Baptist congregations. I also serve as President of Missouri Faith Voices, which is an ecumenical and interfaith network of congregations and faith groups across our state working to address needs in our communities and in our state. I come today to speak on behalf of the faith traditions in support of Medicaid expansion in Missouri. And frankly, we would be open to supporting most of the bills that are before the legislature at this time and the committees. Reverend Dr. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." We believe that every person is valuable and created in God's image and therefore deserves the opportunity to live a healthy, dignified life. We seek health opportunities that value the sacred dignity of every person. There are many people in the room who could speak more eloquently about the economic impact of Medicaid expansion in Missouri. And the faith community is aware of the economic issues. But frankly, our primary concern is the people impacted by this. This is not some abstract issue. It's an issue that impacts hundreds of thousands of our citizens. And in fact, it impacts the most vulnerable citizens we have, the working poor. We believe that every day there are people impacted by our inaction on this issue.